Hello and welcome to Cultivating Commitment. This is the third and last installment of the change management webinars within the Reimagining Prevention series. My name is Jessica Matley. I'm one of the training coordinators for Caltrin, known as the California Training Institute. I'll make sure to explain more about that. And we have quite a bit of content to cover over these next 90 minutes. So I will jump right in. First and foremost, a few reminders. Yes, this session is being recorded. A replay of this session, as well as all of the previous webinars in the series, can be found on the Caltrin or the Strategies TA website. To make it easy, we'll actually drop a link into the chat right now, but I wanted to show you as well. I'm a visual learner, so this is the Caltrin website that you should be able to see on your screen. Just let me know if you don't see it in the chat. But on the website, you'll see at the top, there is a Reimagining Prevention link. If you were to click that link, what you'll find is the ability to sign up for any upcoming webinars, or you can view previous events. If you view the previous events, you'll also see all of the slides and resources that were involved. And if you're looking for resources that have been shared throughout the Reimagining Prevention series, we've got a place for you too. If you click this Browse All Resources, they are nicely coordinated in one place so you can see the funding sources, comprehensive prevention planning, so forth and so on. So we hope that you utilize that and that it helps you out. All right, let me just pop right back to what I was talking about. So if you are a note taker, you'll see that there are some note-taking slides available in the chat now. By clicking that, you'll have access to it's a PDF document. You can print that and follow along today. Although at the end of the training, about 3 days from now, you'll receive an email recap with resources, slides, and so forth. And the very last thing I want to mention and ask is that you do participate in the survey at the end of the training. We ask this because it is a way for us to gauge whether there's any additional support needed or any additional questions that you might have. All right. So I want to direct your attention to some of the interactive features that we're going to talk about today, specifically make the distinction between the Q&A box and the chat. So if you've been, I feel like most people are probably pros for Zoom by now, but I just wanted to make the distinction that that Q&A feature is really intended for you to populate any questions that are coming to mind throughout the course of today's training. It'll be a parking lot. We can keep them there. The team behind the scenes may field some of those questions for the end of today's session, or we might be able to tell you where to go for that answer if it's not within today's training. The chat you'll be using quite a bit. You've already used it during the icebreaker, so thank you for that. All right. And as I mentioned, this webinar is the third and last installment of the 3-part change management trainings within the Reimagining Prevention series. In the first webinar, which you can see them listed out on your screen here, that would be the far left. We started way back in April with the Exploring a Prevention Mindset. That was the first session that we did. In that webinar, we reviewed common prevention frameworks and strategies you can implement as you move upstream towards increased primary prevention work. In Leading Through Change, we focused on the process of change within an organization. That was reviewing the J-curve. We talked about group model theory, team development. And in today's session, we're going to explore a framework that you can utilize for gauging and strengthening team commitment towards a primary prevention mindset. I'd recommend that you watch the webinars in the order that they were delivered. It was an intentional sequence. And if you missed anything, again, you can get caught up on Caltrin's Reimagining Prevention archive, which also includes the resources discussed during the webinar. All right. So before we dive into today's topic, let me just remind you a little bit about the series as a whole, the overarching who, what, where of Reimagining Prevention. So the vision shared throughout is to create an integrated statewide system to reach and strengthen families sooner, to build strong local prevention networks, to strengthen not only families, but communities, and prevent child maltreatment and entry into child and family serving systems. And how do we do that? By building capacity of community partners, by joining with others around a common goal of child and family well-being, and by starting to look at the larger landscape of services being offered across private and public agencies. The collection of webinars and events throughout this series, which began in February, is really to bring all the players of prevention work at different levels of prevention to the table to learn about key foundational principles of prevention and start reimagining the way that we are committing to, coordinating with, and investing in prevention work. Another goal of this series is for a diverse audience to come together to learn prevention principles such as utilizing an equity lens, engaging with communities when developing, planning, and implementing prevention work. The thoughtfully curated topics in this series provide information and ways for agencies to move upstream towards primary prevention together to support and strengthen families. The ultimate goal is for all of us to work together to break down silos and to develop a comprehensive continuum of prevention services that includes primary, secondary, tertiary strategies and interventions grounded in fairness and centered in equity. Now, for the first time, federal legislation has provided state agencies the opportunity to leverage Title IV funds to shift to an upstream approach to serve children and families, and to start thinking differently about when and how we engage with families and the quality of services we're delivering. The state continues to plan for the implementation of the Family First Prevention Services Act, Part 1, which is federal legislation that states can choose to opt into to deliver evidence-based services to individuals that are at imminent risk of entering into foster care, which many of you here are part of that. These services will be provided to families that are involved with child welfare and probation, but will keep the families intact and the children at home. All right. I want to show you a graphic that's been mentioned more than once. So what you see here are, if you've been attending this series, you may have seen this roadmap for comprehensive planning and implementation. You might have seen it more than once, definitely in some of the first webinars of the Reimaging Prevention series. I want to highlight that this change management series kind of lives on the left side of that screen, under guidance and information. This session is going to focus on change management as you are forming, developing, meeting as a prevention planning team, and not on the specifics necessarily of the comprehensive prevention plan or the funding. However, if you do have questions about those topics outside of this webinar, I'll make sure to tell you where those resources live and where you can receive support, especially an upcoming event that is happening soon at the end of this webinar. So lastly, I'm going to mention is we're going to take a quick look at the partners that have been involved throughout this series. We have CDSS. They serve, aid, and protect needy and vulnerable children and adults. We have DHCS, providing access to affordable, integrated, high-quality healthcare. Strategies TA, which provides technical assistance focused on building statewide long-term solutions. And you have Caltrin, providing free professional development and extended learning to professionals, primarily for staff of family resource centers, CAPCs, and other child and family serving organizations. So that's a lot about us, right? But I want to learn now a little bit about you. So I'm going to ask for those on the line with me, where are you? As you can see on our screen, this map represents the different regions and counties of California, and I'm going to ask you to select in the poll, where are you joining from? It's fun when we have counties representing every region, right? Especially, let's see. Oh, wonderful. Actually, I see that you are responding to this poll now, and I will end this poll in just a moment. A couple outside of California, welcome. All right, let me show you where we are joining from. Little bit of everybody. That's great. Excited to have you. Our goal is, of course, to provide this statewide support. And for those watching on the replay, welcome to you too. All right, now my next question is, now that I know where you're from, what is your role? I'm going to share this poll. And if you would take a moment to look, there are quite a few options. And if you don't see yourself represented, please make sure to put it in the chat. All right, so I see people kind of joining from several different roles, which are great. If you selected other, please tell me in the chat. I'm so curious. Wonderful. I'll give you an extra moment to answer. Maybe when we get about 75% participation, we're at 72. Welcome. I see you in the chat. Great. All right, let me share this. So as you'll see, it looks like there's also a nice spread of different representation throughout organizations. I will say that this topic tends to lean towards a leadership conversation as we talk about cultivating commitment, but I do think it's applicable and relevant for all. So I'm excited that you've joined, so thank you. All right, now let's dive into the topic. Now we came together today to discuss tools and strategies intended to assist new or existing teams as they navigate the process of change. Keyword is process of change, and that is cultivating commitment. That's where we find ourselves today. It's about how people who share work and share goals in a collective can effectively produce 3 important outcomes, which are direction, alignment, and commitment towards the goal. The framework discussed today can benefit, of course, individual teams, individual agencies, but today I'm hoping that you can maybe consider the application to cross-sector collaboration and cross-sector partnership. And let me tell you why I say that. This document, this excerpt has been taken from a document. It's the all-county letter, the ACL 2223, which outlines the Family First Prevention Services Program opt-in process and, importantly, the state FFPS program block grant information. So I'm curious if you would just tell me in the chat, have you seen this document? When I say the ACL 2223, do you know what I'm talking about? Have you read it? Yes. Okay. There's a couple yeses. I'll just look at the chat to see if anyone else. Wonderful. Great. Such good news. Well, if you need a refresh, we have I see a maybe, like it looks familiar. Know it like the back of my hand. That's wonderful. So I want to show you, because again, I'm a visual person. If you were looking for this document or you're not sure if you've seen it before and you just want to see it again, of course, you can find the direct link in the chat, but let me show you where you would also find it. What you're looking at here is the CDSS Family First Prevention Services Act. It's like an informational page that talks a little bit about upcoming trainings and information. But if you scroll down a little bit, what you'll see is the ACL 2223 and when it was released. Bookmark, if you haven't bookmarked this page, I highly would suggest it. We could probably drop that link for you in the chat as well. Actually, I can probably do that myself. There you go. All right. So in this letter, so the excerpt that we're looking at here, it addresses the need for cross-sector partnership in the development of the comprehensive prevention plan. You might see your, I hope for people on the call, you might see your agency represented in the yellow. We have child welfare, probation, behavioral health, tribes, Office of Education, community-based services, family resource centers, CAPCs, and those with lived experience. This cross-sector collaboration portion does state at the beginning that counties opting into the program are required to collaborate with cross-sector partners. So I look forward to the strategies that you're going to hear today, and I challenge you to consider the application of the framework that you're about to learn about to the strengthening of your county's cross-sector partnerships. But we're going to start with a little activity. I love to start training with an activity. And this is the activity I want to give you today. I want you to think about a time when you worked in an effective collaborative team. This feels like a behavioral-based interview question, right? I want you to think about a time that you worked in an effective, collaborative team. Maybe it was at work. Maybe it was outside of work. Maybe it was a sports extracurricular team. I don't know. Very specifically, I want you to think about what made that team so effective. What made it feel so collaborative if you had to pinpoint? And then I would love if you would share that response with us. So you can either scan that QR code. It's going to take you to a little question box where you can type in your answer, or there'll be a link in the chat for you. You'll be able to click on that link and respond to the question today. What made your team so collaborative and effective? And if we could just drop that into the chat, please. As you're doing that, I am going to see what your responses say. I actually have a copy of it. Oh, great. All right, so what made your team so collaborative? You can click on that link and it'll take you to a page that will allow you to type in your response. What made it collaborative? And we will watch as your responses roll in. Having an open mind. Yep, that helps. What else? What made your team collaborative? Being a team player, great. Equity of power among the team members, players, wonderful. Everyone's ideas were listened to. Honest communication, encouragement. Softball team won state championship. We each performed our role to the fullest. Yeah, we cared about the outcome. We could pick up when someone wasn't at their best. We practiced individually and as a team. Doesn't that translate on and off the field, right? Determining goals in advance, mission-driven, communication, buy-in, open forums, compassion, small community where we know our coworkers personally. Strengths were encouraged. Great. This is great. I wanted to know, oh, I see in the chat as well. The most effective time was when we all had a role and everyone did their part. Oh, I see some more. I don't want to miss these. Growth mindset. I love that. Focusing on the solutions, right? Positive attitude. Different opinions led to great results. Working together had a great outcome with an activity we had for clients. Everyone performs at their full potential. Communication, flexibility, having the right people at the table. What I love is everything you've talked about today. It's involved in the framework that we're going to be discussing. So this is exciting. And I would say that we could go on and on about this discussion, and we'll probably start to find that a lot of the ways that we would describe a collaborative team experience have a lot of the same ingredients. Leaders encourage leadership, different vision, with similar passion. Great. Thank you. Okay, it's not the last time we're going to talk about that. So as we looked at those list of items that you've mentioned, many of the qualities of your collaboration probably didn't happen overnight, right? We think about the softball team. You didn't all show up knowing how to play together. You had to work at that. Whether you're playing on a softball team or you're sitting around a table like you see here, or in front of a screen like we are today, it takes time. It takes clear vision. It takes a plan. It takes clearly communicating that plan, intentional effort by all members. And it also takes a collective commitment from the team to see the mission through. The qualities listed today, are, like I mentioned, they're part of that framework, the direction, alignment, commitment framework, which you would have seen in the objectives that you signed up for during the training. I want to share that with you now. Direction, alignment, framework. First read about this in an article by Wilfred Draft from a 2008 article. we'll make sure to share that with you in the resources team. That link is not in the notes, so we will get that to you. But here's what I want to say about it. The direction, alignment, and commitment that are discussed in that article are posed as assumed and interrelated and essential elements for leaders and staff that are interacting around a shared goal. This image that you see on the screen is often used to represent what Drath called the tripod of leadership, stating that in order for collaborative teams to work together successfully, leaders needed to ensure that the following three areas were assessed, addressed, and strengthened. So I want to define these, and then we're going to deep dive into it. All right. So for direction, it refers to shared direction. Now remember, this specifically is alluding to teams that are coming together collaboratively, but not from the same team. So it kind of works well for your cross partnerships that we're talking about. Shared direction is the level of agreement about mission, vision, and goal. It refers to the reasonable level of agreement in this collective about the aim, the mission, or the goal of the collective party, the collective group's shared work. Next, we have alignment, which is organization and coordination of knowledge and work, the sharing of resources, but importantly, it's knowing who is doing what. Who is doing what? And lastly, what we have is commitment, or another way to think of it is mutual commitment. It's when individuals making the success of the collective a priority above personal, individual gain. It's really when we switch from that what's in it for me frame to, okay, what's in it for we? How do we experience success in this situation, not just me as an individual? So I wonder as I think about, well, let me show you. I wonder as I look through these examples that you've shared, if this is what it looks like when you have direction and everyone is clear on where you're going, alignment, when everyone knows what the plan is and they know what their role in that plan is, and commitment to see it through. I feel like I could make a good argument that many of these would populate into each one of those sections. Okay. Question I have is, how do you think it feels to be part of a team that doesn't have all of these components? This may be a little rhetorical, but if you'd like to answer in the chat, I would appreciate it. What does it look like to be on a team when you're not sure where we're going? There's not clear direction, or maybe we're not sure, is that, okay, I know the plan, but is this my responsibility, their responsibility, or commitment? What does it feel like when there's a plan in place? No one's really kind of in it to win it. I see some chat responses here. I see meeting just to meet, draining, yep, like driving a car with no wheels or no map, disconnected, chaotic, confused, marginalized, long meetings, great, very frustrating, absolutely. Now here's the other thing. That's what it feels like to be a part of it. For some of you on the call, you might resonate with this. That little yellow triangle on the screen that just appeared, that is in this model where leadership fits in. So what does it feel like to lead in a team when not all the components have thoroughly been strengthened? And I'm curious if sometimes when we talk about cultivating commitment, if what we experience as a lack of commitment, or what we perceive a lack of commitment to be, may actually be lack of direction. It's not that people aren't willing to do it. They just don't know what they're doing, or they're not sure what their part is in it. So from a leadership perspective, I feel like this is even more important to understand what each section is, what it means, and how to strategize around it. The truth is that as you are developing and finding probably a new rhythm with your cross-sector teams, there may come a time when things feel a little bumpy. They may not feel as in sync, and these pieces may not all be there yet. I'd argue that according to the J-curve of change, which we reviewed in the last webinar for anybody there, that process of change is likely uncomfortable. That's actually part of the change process, is a little bit of discomfort. But I believe with this framework, we're going to talk about strategy that may be able to assist with that. Let's talk about that first component. That first component today is direction. Shared direction, like I said, is about the reasonable level of agreement in the aim, the mission, the vision, or the goal of the collective's shared work. Basically, what are we meeting around this table for? What is the goal? What are we in this meeting for? What is the goal? It's about everyone having a shared understanding of not just what needs to be done, but why. I'll give you an example that I've used in my previous experience. I used to lead leadership trainings in person, when in person was a thing. And when I wanted to drive home the idea of a shared direction and the importance of leadership having a team that has strong direction, I would conduct a little exercise. So envision this with me. I would ask all the participants in the room, I'd say, all right, everybody, close your eyes. And while all the leaders in the room, while their eyes were closed, I would say, now I want you, with your eyes shut, to point in the direction of north. Point north. And around the room, some people pointed with confidence. They were like, it's that way or this way. Some people said up, which made me smile. Then I'd ask them, with their eyes closed and their hands in place, to open their eyes and look around the room. And what we would see is people pointing in many different directions. Sometimes there might be people pointing in the same direction, but not often. And then I'd say, imagine if instead of asking you to point north, I would have told you to walk north. We would have all ended up in different corners of this room. The moral of the story in that leadership exercise is that north is open to interpretation when you don't clearly outline where it is. It was dependent on how well the participants had an accurate bearing of their location. It was dependent on my interpretation of north. Is it true north? Is it north to me? Long story short, if members of a team, big or small, do not have a shared vision, don't have shared language, shared understanding, they may not be moving in the same direction. Directions about ensuring that a team knows where they want to go, have a clear vision about how they might get there, and understand why they are going in the first place. So I was going to ask you what it feels like to be part of a meeting, a team, a project where clarity is not established. The direction is not, no one quite knows what we're doing or why we're doing it, but I would scroll up and say, you probably would echo what you've already said. Chaotic, disconnected, confusing, frustrating. Yeah, this was, I could have been doing something else with my time. Absolutely. So what are some strategies or what, how might we gauge if we are in a position within a team where we might need to lean further into direction and to clarify that before we move on to alignment? So I want to show you in the next slide what it could look like when direction is happening, and maybe what are some symptoms if it's not. What type of behaviors or actions might we see when direction and the level of agreement is going on? I've listed a few. If you see any others, love it if you dropped into the chat. We would see shared outcomes for success. People have an idea of what success looks like and how we know when we're getting closer or further. We would have clear vision of what needs to happen. Do we have a timeline? Do we have an expectation of deadlines? Do we have an agreement on what the goals are? That's important. We would see common interest and a common interest and mission in the goal. Now, direction is really the foundation for the other two components. If we talk about cultivating commitment in your teams, you can't cultivate commitment. In other words, you can't, well, it's very difficult to cultivate commitment in getting your team or cross-sector teams to move in a direction if they're not clear on where they're supposed to go in the first place. So when it's not happening, when we don't see direction strengthened in a cross-sector team, what behaviors, what do you think is not happening? So if this is what's happening, what do you think is not happening? How are the balls being dropped? How are things maybe being derailed a little bit in the chat? What type of behaviors? If these are symptoms that direction is happening, what might some symptoms be that it's not? Take a moment to think about that. And then please put it in the chat. What are behaviors or actions or symptoms of no direction? Okay, I see some coming through. I see no progress made. That's a big one. Oh, are you reading the slide? I will show you, just kidding. When it's not happening, repeating mistakes, yep, absolutely. Having to revisit conversations, absolutely. Didn't we already talk about this? Stalled, confusion. We're going to see a lot of confusion. When it's not happening, what you might see, it's difficult to agree on next steps. It's hard. There's confusion and frustration. There's no sense of urgency. There's a lot of delay because we don't quite know where we're going yet. So of course, it's a lot of maybe revisiting and talking through. Like I said, it may be that the direction isn't clear. Well, I guess the question is, what might be reasons why direction is not happening? We might chalk it up to 3 different categories, but I'm sure that there was more. The direction isn't clear. You assumed that people came with information they didn't have. Not everybody started in the same place. Maybe some people entered the conversation with more history, knowledge, experience. Maybe people entered the conversation with more relationship with another partner, another team. And we didn't establish that kind of team bonding, which we would have learned about in the last series with the norming, forming, storming. Maybe there's a disagreement about the direction. Maybe the reason why we're not making progress is we haven't quite agreed on what we're going to do yet. Or possibly there's a resistance to creating a shared direction. And that resistance may be because change is difficult. And change is a very unique personal experience for everyone. And so you may have partners, team members, staff, whatever, colleagues, that on the J curve of change, of process, it may not be as easy for some than others. So that may lead to why we don't see direction being strengthened in a team. We're going to talk about strategy on what to do about that, but let's first talk about alignment and really clarify what that means. So alignment is about organization and coordination of knowledge and work. In other words, who is supposed to be doing what? This step naturally follows direction once everyone's clear and agrees on the vision and the plan and where we're going. Each party next has to take ownership of their piece of that plan. And more than that, each party understands the importance of their role in the process. I'm going to propose a slightly silly example today. But I'll be honest, it was the first analogy that came to mind, and I'm going to follow my instincts on this one. If you can relate to this example, I'd appreciate your encouragement in the chat. Now, it's about a potluck. It's about organizing a large potluck. Those might not be a thing yet, again, but try to remember this with me. I remember working in a large organization. Think about a big department, and you're going to have a departmental potluck. I mean, we're talking dozens and dozens and dozens of participants. I worked for an organization that so well organized major potlucks because they assign a dish by last name. For example, if your last name was A through G, you were bringing the side dish. If it was H through M, you were bringing the main dish. Maybe N through S would bring a dessert, and T through Z were in charge of drinks and plateware. It was a way to keep things organized, to ensure that everyone understood their role. So, what am I supposed to bring to this potluck? It would rotate, don't worry. People weren't always stuck with the same thing. But what am I supposed to bring? That was clear. It ensured that all the bases were covered. In other words, there were no gaps. So we had all the food we could eat with no plates to eat them on. And importantly, it ensured that we didn't just have one massive dessert potluck. In other words, it helped avoid duplication. It helped an even spread. Now, silly as it may be, when we apply this concept to your cross-sector teams, it's important to ask, does everyone at the table understand what they're bringing? Is it clearly outlined so that there isn't duplication? And has it been planned to assess where there may be gaps and how to bridge that gap before we encounter the issue? Also, does everybody know what everyone else is bringing, right? Are we sharing that information? So when we think about alignment and what does it look like when it is happening, these are maybe some of the things we would see. We would see roles and responsibilities that are clear and known. Everyone knows what everyone else is supposed to be doing here and what they're supposed to be doing. When it's happening, we see collaboration, true collaboration, reaching out when you have a question, sharing a resource, bringing your knowledge to the table and saying, hey, does everyone have this? It's being thoughtful to the experience of those at the table. And it's complementary. Someone said in our review of what a collaborative team feels like, we talked about kind of filling in gaps where there may be deficits, right? So it's a strengths-based model, kind of lending your strengths to areas where there may not be a strength. Pieces are fitting together. Now, what do you think we see? What symptoms might you see in a team when alignment isn't strong? I'm going to ask you to put that in the chat. I see in the chat. Oh, that's funny. Thank you for resonating with my potluck. All right, so in the chat, what might we see when there is not strong alignment in a team? Think about cross-sector teams. If people aren't sure what they're supposed to be doing, what are some symptoms? I'll let you think about that. Everyone's assuming it's someone else. I thought you were doing that. Oh, I thought you were doing that. Things get missed. They don't get completed. There's holes. Clients lack the services that they're eligible for. Miscommunication, lack of engagement, not moving forward, not following through. Isn't it difficult to cultivate commitment on a team when people aren't really even sure what their role is? You're asking them to commit to something they're not too sure what's going on around here, right? So some of the things that we might see, you've already echoed, I appreciate it. Confusion, duplication, gaps, working in silos. You might say like, okay, I'm just going to work with this person because they seem to know what's going on. So now it's just going to be us. And you created a silo within a cross-sector partnership that was intended to break down silos. We might see competition. How we get here, or maybe why we might not see an alignment, it could be because the coordination processes are weak. Let me tell you, from my experience working and leading leaders, being able to organize a collaborative team and coordinating the process of many different pieces is a completely different skill than being able to do your area of expertise well. They're different. And so I say that because it's important to know that it's not intuitive. If it feels difficult, it is. Yeah, it is difficult. And so it takes strategy and it takes time, but it also takes an awareness and an acknowledgement that it's not going to typically happen on its own, and problems are not going to fix themselves. And so it's important to identify where are those strengths in coordination within a team and being able to come up with a plan and monitor that plan and execute that plan. It's really we might also find ourselves here if we leap before we look, that we kind of stepped into a plan without fully fledging out what was going to happen next. Or the responsibilities aren't clear. No one's quite sure of what everyone else is doing and why they're doing it. Don't worry, we're going to talk about strategies around that too. But let's talk about that last area first. And that would be commitment. Commitment's about individuals making the success of the collective, of the group, a priority above personal gain. When we switch from that what's in it for me to the what's in it for we, I believe that commitment feels a little bit different than direction and alignment. When I talk about it, when I think about it in this framework, direction is about understanding what you need to do, right? So having a vision of where you're going to go. Alignment's about understanding your role in the process. But commitment is about whether or not you're willing and able to do it. That is kind of discretionary effort, I think, when it comes to commitment. Let's apply this idea and let's think about how we might know if commitment is happening or not in a group. And I also want to say that this process, these steps that we just talked about, are intentional. It's very, very difficult to get commitment or to cultivate commitment without a strong alignment of who's doing what. And it's hard to have an idea of who's doing what if we don't have direction of where we're trying to go in the first place. So you see, these are all connected together. So when commitment is happening, we might see trust and rapport is being built. Partners are reaching out to each other. We have a rhythm. We have standing meetings or standing agendas, and we're following through on those agendas. People are working with a sense of urgency that this is a priority. We've got to make this happen. And yes, there's challenges. Sure, there's challenges, but we're going to be strengths-based and problems resolution focused. Teams are willing to try new processes because they trust that J curve, right? They trust that, and if you don't know what I mean by that, please watch the previous webinar. They trust that in the times of what might feel a little bit like chaos, that the collective will be able to identify the challenges and to systematically and collectively overcome those challenges and be resilient through it. So when there is not commitment, when these things are not happening, what are you seeing? What behaviors do you think you would be seeing in place of that? I'm going to ask you to put it into the chat. What behaviors or actions are we seeing? I see no buy-in, no commitment. Falling behind, absolutely. Burnout, Yeah, complacency. Absolutely. Why am I putting all this effort in if it doesn't seem to be a priority for anybody? Or, yeah, apathy. Like, maybe it works, maybe it doesn't. Right? Absolutely. Not meeting the end goal. Yeah. I'll tell you what we don't see: results. We don't see them because when there isn't a commitment to the success of the collective, it's going to be very challenging to see a result because it's the trust rapport may not be there. People aren't working with a sense of urgency. No one's willing to try something new. So we think about how we could get to a place where there wouldn't be these things. What we don't see is no follow through, minimum action, minimal effort, attrition. Attrition may be a human resources word, but that means that people start to leave. They leave the conversation either physically, like, all right, I'm out of this one, or mentally. They are planning next week. They're not even here. An imbalance of importance across teams to produce results. I absolutely. So how did we get here? How could we get to a place where commitment was not cultivated? It is possible that they don't feel responsibility for the group. There's no responsibility for the group because possibly in the alignment phase, it wasn't clear that this was my responsibility. And if I think it's someone else's job, I'm really not going to be that committed to the process. Don't see themselves as part of the group. And these next ones I think are important. I want you to think about that. Think about all the different partners that we talked about in that ACL that are coming to the table that may not have worked together as closely before by nature of your work. Don't see themselves as part of the group. Don't want to be part of the group, or they don't really understand how they got to the group. Or they did show up, but they don't feel included and they do not feel valued to be there. From a leadership standpoint, the commitment really comes from ensuring that everyone at the table has a place at that table, that they're welcomed and valued at that table, or to the discussion, call it whatever you want. But in the collective, I should say, that they see themselves as a part of it, understand their role in that part, and feel valued for being there. I actually saw I will challenge myself to find it. As we look through this, let's see, listening to one another, I would say that feels like commitment, communication, encouraging qualities in others that might go to feeling heard, having the right people, of course. But I did see one. Let me find it. I think it's more of like the equity, the encouragement, the communication, and it's having a plan for everyone that has come. It's not a waste of everyone's time if everybody came with a part of that plan to be executing, or at least the next step of what to do next. All right. Breathe that in. So we have covered the 3 sections, but now we're going to start getting really specific to you and to where you are in this process. And let me tell you how we're going to do that. As we covered these components, this direction, this alignment, this commitment, I asked you in the beginning, I challenged you to consider your current team. Think about your current cross-sector team, or the one that is being developed, the ones that you are strengthening. And I asked you to consider how you might apply these principles to that situation. Now, for some of you, if that does not apply, then think about your agency. But I'd love it to be a county-wide consideration here. I want you to think about which of those areas may need some further focus or attention right now in your situation. If you had to guess an area of focus, an area that might require additional strategy, and you had to speak on behalf of your team, where do you think that would be? I actually have a poll, so no need to drop it into the chat quite yet. What do we think? What area do you think you are in your current situation? I see alignment. Okay. Mhm. Some people might say, hey, Jess, is there D, all of the above? I get it. I get it. It's okay. Change is a process. Okay, great. I see people answering. Thank you. Give you a second to respond. All right. Probably take some thought. All right. As you're finishing up, I will end this poll in just a moment. All right. Let me share these results. Some of you are still thinking about it. Kind of individually spaced out, right? It's almost a third in each one. Okay. Good to know. Good to know. Let me tell you what we're going to do about that. I asked you what you thought, just from what you've learned so far. But how do you know? How could you better assess that? You may have taken a guess based on what you've heard about this framework, and as we reviewed the different options and what it looks like when it is and what it looks like when it's not happening. But maybe there's a better way, maybe a more structured way to assess, to gauge. I want to walk you through a tool that may help you identify where your team could be, maybe, needing focus and strategy in a more structured manner. And that would be the DAC assessment. I told you the direction alignment commitment was spoken about in an article that'll be included in your email resources. The Center for Creative Leadership has a free online, super quick assessment, 15 questions in 3 different areas of direction, alignment, and commitment. Although we're in a webinar, I do want this to be an interactive experience for you. More than anything, I want you to feel like you're leaving today with a now what. So what we're going to do is we're going to take 3 minutes, and I'm going to do it now because you know and I know that you've got busy days, and once the webinar is over, it's going to be a little difficult to find some time in your day to go back and look at the resources. I know how it goes. So what I'm going to ask you to do now, I'm going to ask you to take 3 minutes. I'm going to set my timer, and I'm going to ask you to complete that deck assessment. Oh, thank you. Sorry, out of habit, team, I dropped it in. So for that DAC assessment, I'm going to ask you to click that. It's going to take you to a page that looks just like this. You're going to take these 3 minutes. You're going to take these 3 minutes to consider to fill out the assessment and identify where is your score the highest and the lowest. So let me go, actually, I have a copy of the CCL page, I believe. So from 1 to 5, 1 being, that's not me, that's not us. When I think about my team, can't say. 5 is like, you've read our diary. That is us. So I'm going to ask you, like I said, 3 minutes on the clock. Go ahead and fill this out now while you have the moment, and then we're going to reconvene and talk about it. Go ahead. I will wait. I will keep time. This is not check your email time. Friendly reminder. This is your halfway point. You have 1:30 left. Great, we have 45 seconds. And 10-second countdown. And a 3, 2, 1. Thank you. All right, everyone. I really hope that you took this time to go through it, to look through the tool, to try it out. Now, I asked you, what did you think? Where did you think you needed some support, some strategy, some focus? And you answered, and it was a little bit all over the place. I'm curious, now that you've done the DAC assessment, how that might have changed. So I'm going to ask you again, we're going to go back to the Mentimeter, which is a really fun app. That's what I've been using. I want to know, what were your results? So if you click that QR code or you click the link in the chat, it's going to take you to a voting, I believe. It's actually the first time I've tried it, so let's test it out. Oh, it works. Woohoo. Okay. Okay, so I'm going to ask, where does your team need focus? And then we'll see the votes as they come in. Oh, you might ask, Jess, how do I know? The score. The scores in each of the 3 areas will help you determine if there was one in particular that was the lowest. If they are all rather low, or if they're all the same, then I would make the case to start in direction, because direction is the foundation. Based on that, where do you think your team needs to focus from your results? Great. Fun. So it looks like we're still kind of in that alignment. Alignment was the winner before. It looks like it is again. Great. Thanks. All right. I'm curious for anyone on the call, did your answer change? So in the chat, did your answer change? And if so, what did it change from? So you thought maybe we are in the commitment stage. I'd even argue before you got to this webinar today, did you think you were in the commitment phase? But it turns out you're kind of in the direction. You need to focus in on that. Did you maybe think it was alignment, but after reviewing the questions, yep, yes, from alignment to direction. so common, so good, because now you know. And it's difficult to identify where to start sometimes. It's never a bad idea to start in direction. Still the direction stage. Great. From commitment to alignment. Absolutely. Yours matched. Great. Often, from a leadership perspective and from leading leaders, the question is, why is no one doing what I've asked them to do? Why aren't they just doing it? Or you start to wonder if people even want to do it. They must not agree, or they must not. You start to think of assumptions of why the process has stalled. You start to assume that it is a challenge in commitment, when in fact, it may be a challenge in alignment or direction. Okay, thank you all. Appreciate that. So now let's talk about where to begin. So you went through this process of where to begin, and I asked you, to consider where you think you are. But that's just your perspective. Remember when I said about that activity about pointing north, and everybody needs to know where north is and where north isn't? Someone actually said it earlier. Where do you begin with this DAC assessment? Would your team agree with the assessment results that you've identified? If you are one partner amongst many partners, would everybody at the table, would everybody in the conversation, everyone in the collective agree that the area you need to focus on is alignment? That direction is done. Check. Yep, got that. Now we've moved on to alignment. Or now we're moving on to commitment. When leading a team and trying to cultivate commitment, you may feel lost yourself as a leader on where to begin, especially in a team that's finding a new rhythm together, like your planning teams. It's a good idea to take this assessment together. Doesn't necessarily mean that you have to have one score sheet. Everybody can take it and then share their results. This will provide you, especially if it is your charge, to put all these pieces together. So you are a holder of the majority of these pieces. It may provide you with some valuable insight. Into where people feel that they need support, how the different members perceive the current state of the team. Remember that you can't cultivate commitment until direction and alignment have been established. I've utilized this particular assessment in the past with leaders in California at different family resource centers and such through trainings, Caltern trainings. Some may even be on the call, which would be exciting. And after taking it, they've reported how helpful it was to not just take it for themselves and gauge where they thought their team was, but then to pose it to their team as leadership strategy and seeing, am I correct in what I believe the challenges, what the challenges are? And many have been surprised that they were thinking it was alignment, but many of their team members found it to be direction. It's good to know as a leader, as you're building and navigating a plan. It also takes the guessing out of the equation. When you're a leader and you're trying to cultivate commitment and you find that the efforts are not feeling successful and you start to guess and wonder, this is a great way maybe to get below the surface, right, of that iceberg problem. Not just what you're seeing, but what might be experiencing under the water. So now that we've covered the different components, I'm going to start the conversation about strategy. So what do you do about it? So what if it is direction? What if it is alignment? What if it is commitment? Then what? This is actually a shorter portion of the webinar, and then we will, if there's any questions, we'll take questions at the end. For direction, here are some, we'll call them basic strategies. I do think it is dependent on your specific situation, and there are many more to add to this list. This is just to get you going. Of course, it starts with a shared vision and goal, ensuring that everyone at the table understands what we're doing here and why. The Reimaging Prevention series is a great way to start. Have the partners in the conversation been following along with the Reimagining Prevention series? Let's say that you are an organization that's maybe traditionally been more based in tertiary services. Exploring a prevention mindset, which was the first webinar in this 3-part series, would be a great place for your team to start if not everybody has watched it, to get an idea of how do you weave primary prevention mindset into a process that maybe didn't easily and traditionally do that. Ensure that everyone has a place in the conversation. Acknowledging the benefits. How is this process going to benefit families? How is this process going to benefit our agencies, our county? I think that goes back to the direction of not just what, but why. Acknowledging the challenges and the solutions, getting it all out on the table. Very recently, there was a conversation about the community engagement toolkit that was a webinar. It would be in our Reimaging Prevention replay archives. But Junius Williams talked about an assessment. Oh, I want to remember it so much. It begins with a T. Maybe somebody on this call will remember. But it's an exercise where people come to a conversation and lay out all the worst case scenarios. Okay, what's the worst things that can happen here? And it's a way to get them all out and then process and work through them. Anyhow, it's that idea of identifying challenges before they happen. It's a great way to set a clear vision and assess your strategy. The next would be alignment. So if people are sure of where they're going, they're just not too sure what they're doing when they get there. It's role and responsibility clarity. Think about the cross-sector partners that were on that list. How often have you worked with them in your role historically? Often? Do you have their contact information and you can pick up the phone and call them right away? Are you not as familiar because you didn't quite intersect as much in the past as you will now? That role and responsibility clarity isn't just tell me what you do. It's also rapport building. You would have found that in the last webinar in this change management series called Leading Through Change. Ensuring that everyone has a role and is clear on when what it looks like. Clear deadlines and next steps. Are you walking away from a conversation with knowing what and when things are to be done? What and when? And how, if that needs to be clarified in that conversation. A shared communication platform. That's when we're, bringing resources in one place so that everybody has access to the same data, information, shared resources, and knowledge. Are the people in the collective familiar with the ACL, right? Someone on here said, I know that like the back of my hand, which is so great to have that. It's important to ensure that if people are coming to a conversation, the collective, and that is an important piece of knowledge they should know, that there is an easy and available sharing of that. The roadmap to comprehensive prevention planning, which has been, a staple of this conversation throughout the series, and tools available within that plan. What are the tools? Have you used them? Do you know how? Do you need support? Do you need help? That alignment is figuring out who's doing what. And then, of course, maybe a review of the OCAP prevention framework discussed in our first change management webinar, which was called Exploring a Prevention Mindset. That's an exploration of what are the strategies and definition of primary prevention, secondary prevention, tertiary prevention, and intervention. When I say under alignment, that's because people might have to find out where they fit in that process and how they may have more of a role in primary prevention than they may have otherwise known or thought of. And of course, lastly, we have, thank you, team. It was called the TRIZ. That's right. And that link is in the chat. The TRIZ is the exercise where everybody comes to the table and just kind of gets all of the worst case scenarios out. You'll also see, thanks again, team, the OCAP framework for prevention. And lastly, what are some strategies for commitment? Well, feedback loop. Building an opportunity to provide feedback about what is and what isn't going well. That has to be transparent and honest and constructive. As a matter of fact, Some of those words that you used when we talked about a collaborative team that you've been on, honesty was a big part of that. And I even asked you, what is a quality of a leader? You said honest. Well, sometimes you have to be honest, and sometimes that honesty is difficult. That is part of the leadership process, and it's part of the change process. We're talking constructive, honest framework. And lastly, responsibility and accountability, which are not the same thing. In leadership, they say that you should not expect what you are not willing to inspect. Do not expect what you're not willing to inspect. In other words, where and how are you integrating quality control into your group? Establishing deadlines, providing and receiving feedback, creating accountability. That's all kind of part of this commitment strategy. Again, it is not an intuitive or quick process, but knowing where you need to start is your first step. Okay, I'm going to talk about some next steps, and then we're just going. I will answer any questions that came through in the chat, and provide any next steps or redirect you if it's not something that's covered in this conversation. So what do? You're like, all right, Jess, ready. Now what? Go take that DAC assessment with your team. That's number one. That's what I would advise. When I say your team, I'm hoping your county team, right? The people, the partners, those cross-sector collaborators, do it with them. Those reimagining prevention replays on our site, on the Caltrans site, there's a lot of great information in there. There might be a lot of gaps in knowledge and understanding throughout the team, just from their experience, or maybe they haven't had a chance to watch everything. I would advise that you at least go through to ensure who hasn't seen this information, to assess any gaps before you move forward. Attend the statewide prevention planning convening. This statewide convening can be found on the Strategies TA website. I actually have that too. Okay, so here we are. If you're at the Strategies website, you can find it under events. I believe we're in events. Oh, no, we're not. Or the Reimagining Prevention series, which is also here. So you can scroll down. Here we are today. The statewide child abuse prevention planning convening, and you can register. There's some links down here to register. There's also a link in the chat to get you over to that page. In this convening, which is taking place June 1st through 3rd, the objectives are understanding FFPSA Part 1 in the context of comprehensive prevention planning, providing support to counties around the capacity and readiness assessment for FFPS program, learning from current prevention planning counties and peers, and gaining an understanding of available TA support. Highly recommend you join the team discussion and receive some great information and next steps there. And overall, here's some more generic next steps I'd recommend. Of course, it's what do you know about primary prevention? And when I say that, you might know what primary prevention is, but you may not have considered how your work can be primary prevention, or where you would go to learn more about that. How do you move towards a primary prevention mindset? That kind of starts with assessing where you are now. I'd highly recommend the first webinar in this series, Exploring a Prevention Mindset, if you want to review that. Look at, familiarize yourself, review, and complete the comprehensive prevention planning tools. That would be the Collective Impact Community Engagement Toolkit, the Capacity Building Assessment, which is available, the Readiness Assessment, and newly released, the Data Playbook, which is now available. I'll show you that in a moment. It's asking, who is your local prevention planning team and or your CAPC? And of course, if there's questions that you have that are specific to the funding, the governance, the evidence-based practices, I'd recommend, I'll show you again, this, which I hope you've bookmarked, this Family First Prevention Services Act info page on the CDSS link here. This email right here. This is the email I highly recommend, and you are advised to send questions to if you just are feeling a little stuck. If you have a question, your FFPSA Prevention Services Part 1 questions are to be sent here. The FFPSA Prevention Services at dss.ca.gov. That's also been dropped in the chat for you. Now, I mentioned the data playbook, by the way, which is a newly released document. You may have received that. I hope you received communication about it. And that information has been dropped into the chat, so you can find it there. So what is it? It's for prevention action planning. It's to facilitate the numerous efforts currently underway. So Safe and Sound, in collaboration with many state and local partners, have created this comprehensive guide to help county level prevention planning teams. That might be you. Source, select, gather, analyze, and share data to develop their prevention plans for AB 153, FFPSA, and other initiatives. Sharing, gathering, analyzing data sounds a lot like direction and alignment to me. So I think this is perfect in the context of the conversation. All right. And the last thing I'll mention, just in case people do not stay around for the Q&A, there is a survey. Actually, if we can drop the survey now, just in case anyone has to scoot early. The survey will provide an opportunity to let us know what has been helpful to you in this Reimagining Prevention series around change management, in today's webinar. What are you going to do next? Do you need any help, right? What were your takeaways? What are you committing to doing next? So the webinar materials will also come in a follow-up email in 3 days. They'll be on our website. And of course, you're highly encouraged, and I ask you to please sign up for that statewide convening that's happening. Okay, with that, before I open up Q&A, I'm curious for those on the line that have so patiently gone through these strategies with me today. What is your takeaway from today? Do you have a next step? What has been your greatest takeaway and next step from today? You didn't attend just to attend. You came here for a plan. So I'm going to ask you to drop that in the chat. What's your plan? How can we support? Give you a moment to think about that. I can just hear you typing away now, so I'll be patient. There's a lot to process, of course, but if you had to think of a first step, what is it going to be? Is your first step to do the DAC assessment with your team? Is your first step to sign up for the state convening? Is it to bookmark the FFPSA info site? What do you think? It is a lot to process. I will highly encourage you. Have you heard of analysis paralysis? There's a lot of information to be had and gathered throughout the entire series, but it's important to challenge yourself to think of a potential next step, because my favorite saying is never leave the scene of an inspiration without a next step, because that is how really momentum falls off. It'll fall off when we don't have like a next step on how we're going to implement, or even idea of where we would start. Providing a primer on prevention planning for the team in advance of completing the prevention planning capacity assessment tool. Great. I'd like to extend the information in the survey to my team to discuss what we all get and then go from there. Great. Cynthia, yes. I think the next step is to look at the projects to do and share DAC assessment with the team. I couldn't recommend that more. The DAC assessment is a great tool. Yeah, take a temperature check. Absolutely. Where are we? It's going to be hard to meet needs when you don't know what the needs are. And it takes a lot of guessing off your plate. We will be discussing and completing DAC assessment at the next staff meeting. Way to go. That is a, what do they call them? A SMART goal. You said, we're going to do this, and this is when we're going to do it. You know, and I know that it will get busy. There will be more webinars with more next steps. If you don't have something on the calendar, it is very easy. It happens to me all the time. Very easy to say like, oh, I meant to do that, right? So I'd highly encourage if you're kind of like not sure where to start, maybe share that DAC assessment. Maybe start there. If you were based just off of this webinar. All right, with that, I'm going to ask for any questions. If you drop them into the Q&A feature, I will be fielding the calls. As of now, I'll say I have completed, oh, there's another one that came through. As of now, we've completed the webinar portion, so I will stay as long as you need to answer questions and point you to resources if you're looking for them, if they're not related to this webinar. Please do take that survey. It is incredibly helpful to us to understand where you might need and want support. This concludes the 3-part change management series. So if you've been here for the last 3 or for the last 2, this being the 3rd, thank you. Very grateful for your time. I see another next step. Take a look at some of the links that the Caltron team dropped. Those links are going to be housed in an email that you're going to get in the next couple of days. But don't forget, we're also going to house them on the Caltron website. And I'll show you where, just in case you need to find it again. Here it is. So here we are. On the website, you'll see on our main website at the top, it says Reimaging Prevention. We've separated it just so it's easy to find. You click that, you can see all of the previous events in the series. So starting from way back in February, we did Equity and Community Voice as the foundation. This was the Reimaging Prevention kickoff. The recording, the slides, the resources, anything discussed and everything discussed is all there laid out for you in order. If you just want an overview of the resources in general, if you just kind of like, give me a list, Jess, you got it. There will be a Reimagining Prevention resources button, and then all of the resources are linked in there as well. Just makes it easy for yourself. Okay. I will hang out for questions. Let's see. Let's see here. It looks like I have a question about the data playbook. I can give you an overview of where to find it. And I can actually do that by clicking in. I'm going to go scroll back through the chat. All right. The data playbook and prevention action planning, which, like I said, is one of your tools. I wish I can share 2 screens at the same time. Let me see if I can. Okay. Let me try this. Let's see if this works. Oh, good. So from that roadmap of comprehensive prevention planning implementation, all of these bubbles, if you will, represent different stages and tools within the planning and the implementation of your comprehensive prevention plan. That data and mapping, it can be found here in the capacity building phase. I've also heard it discussed in other phases as well, but you might need a formal playbook, like the who, what, when, where, how to use it, what it is, who's involved, and that is what this document is. We dropped that into the chat. It is an extensive document. Let's see. I'll show you with this view. Not only does it give you an idea of who is intended to lead this discussion, how, but it also gives you an idea of how to move forward, strategies, how to use the data playbook, so forth and so on. It's extensive because it also includes several links that'll take you out to other areas. But like I said, if you have some specific questions about the data playbook, or you're curious on how to use it on your teams, I would say please attend the convening. A lot of great TA support there. Ask away. And also, I would send, if it's specific maybe to your team, and you're not working with like a TA yet, then I would send to the FFPSA email that we talked about on that on the DSS website, CDSS website. Thank you for being here.